Alright, so we're going to discuss the steps of bonding a permanent retainer. First, you can see the setup here. You're going to need a ligature cutter so you can cut the wire. This is your wire. The brackets have already been removed. You're going to need a pickup so that you can place the wire. This is your bonding agent, your flowable composite. We use Gradian specifically for this, just because of the viscosity. Etch, a micro brush to place the bonding agent. I've got a scaler. I'm going to use this to position the wire, and also in this case there's a little bit of calculus that needs to be removed, so we use a scaler for that also. You've got your light cure wand, some cotton rolls, and some pumice. So as I mentioned, there's a little bit of calculus, so the first thing that we're going to do is remove the calculus. We cannot bond a fixed retainer on top of calculus, so the important part of this first phase of the video is I want you all to be able to recognize when a patient has composite, to be able to identify that, excuse me, not composite, but calculus, to be able to identify that, so that you can alert me, and I can remove it before we start the etch and pumice process. So, open wide, please. Tip your chin down towards your chest as much as you can. Okay, open really wide. So what you want to do is, it may be difficult to see in the video, but you want to look on the lingual surfaces of these teeth, and you want to see if there's any buildup along the gum line or on the surfaces of the teeth. And if there is, then it needs to be removed. So one option, open a little wider for me, one option is to refer the patient for a cleaning before they come in to get their braces removed. As you can see, as soon as I started to try to remove the calculus, there's a little bit of hemorrhaging, and that can get in the way when you're trying to bond. That can interrupt your isolation, contaminate your isolation. But his was pretty mild, so we did not refer him for a prophy before the debond. And so the second option is just to go ahead and scale the teeth in the office prior to the debond, yourself or myself. It's not, a very difficult process. The only reason that we would consider the first alternative is just so that we can avoid this hemorrhaging prior to bonding the wire. We'll go over some techniques to try to minimize this hemorrhaging. However, it's important to know that when there is hemorrhaging, that it can contaminate the field and prevent establishing a good bond.